Developing now, concerns are growing over this resurgence we're seeing of COVID-19. Cases of the Delta variant are on the rise, and there's pressure to get the vaccine into people who have not gotten it yet. President Biden says the best defense against the virus is the vaccine.
And when asked about cases of people who tested positive despite being fully vaccinated, he said very few of those have been reported. Take a listen.
Those that it happened to, it may be possible, I know of none where they're hospitalized in ICU and or have passed away.
And the president went on to say the symptoms were not as serious in those breakthrough cases as those in people who have not been vaccinated.
Well, as for those who are vaccinated, there are some now questions about whether or not a booster shot might be needed. Today, a CDC panel will meet to discuss that possibility. And joining us right now to talk about the latest is Seminole County Health Director, Dr. Todd Husty. Always great to see you, Dr. Husty. How are you?
Oh, Amy, it's nice to be back, except usually when I'm back, it means something bad's going on with COVID.
Right. Nobody wants to be the bearer of bad news.
No, not at all. And I am looking forward to this meeting today, though, about whether they're going to recognize that we might be needing a booster. And, it's going to be a big meeting.
Yeah, there are some cases that are popping up that are concerning, right? And one of them was there was a host from ESPN who had gotten the vaccine back in January, and then he said he tested positive and was having symptoms 6 months later. So then you start thinking, well, gosh, it's been 6 months since he's been vaccinated. Are we at that point where you might need that third booster shot?
Well, Amy, some of our immunizations last maybe a lifetime. Even to some viruses, measles, mumps, rubella, polio, smallpox we got rid of, it lasted a long time. But then you look at flu virus. And the flu virus, in about 6 to 10 months, you lose most of your immunity to the flu virus immunization, to the flus that you were immunized for. And we think the coronavirus is probably going to follow that. So that means we are 6 to 10, we're 6, 7, 8 months down for some of us. I'm about 7 months old into this, and it's making me nervous, quite frankly.
So who would you say, and I'm sure this is something the CDC will discuss today, who would you say would be sort of ripe for that third shot? Would it be over a certain age, maybe the elderly, people with weakened immune systems? Who would fall into that category?
Well, I think we all will eventually. I mean, everybody that falls in today will end up there, but I think it's going to be rolled out just like it was before. We did have 2 deaths in Seminole County from people who were previously vaccinated. They were elderly, long-term care facility residents. So it is happening. Dr. Biden shouldn't answer doctor questions. It is happening. There are people that are vaccinated getting it. Most do not get severe disease, but some do. So I think they'll start with the people in long-term care facilities, people over 65, which includes me, and then it'll start moving its way down like we did before.
I want to talk about mixing vaccines because one of the stories that's come out this week is that the J&J vaccine does not do a great job of keeping this Delta variant away. So if you're one of those J&J recipients, would you benefit from maybe going and getting 1 dose of a Pfizer or 1 dose of a Moderna? What happens if you mix the vaccines?
Well, you're going to continue to get immune responses, and I'm not sure that I'm even qualified to answer that, Amy. But talking about if you've had the J&J, should you get another one? I don't think that there's a lot of harm in it. I mean, when we really examine these vaccines, they're very, very safe, and getting yet another shot, another booster, if you will, doesn't seem to be causing problems. They're already testing these things out. So I think if you've had J&J, you hold on. I think there will be good advice as to what to do or what not to do, but hang in there for right now and do everything else. Wear your mask, social distance. I mean, that's easy. That works.
I was reading a heartbreaking account from a doctor in Alabama who said that she was about to intubate a patient and the patient was not vaccinated and that they had COVID, and they were saying, is it too late? What if I get vaccinated now? And the doctor was saying, I'm so sorry, but yes, it is too late. What do you want people to know who are holding out and thinking, oh, I'll get through this, I'll be fine?
follow the science. I understand how people were hesitant because this is emergency use order. That's what I hear the most of. And it's emergency use because we did this in record-breaking time and we had to. But that doesn't mean that it hasn't been really thoroughly tested. Come on, there's 100 million doses of everything out there right now. And if it was doing something horrible, it would have done it. So if you're riding the fence, follow the science. Don't follow the myth. And don't follow social media. Follow the science. And the science says it's very safe. And getting this darn thing is not very safe, even in younger people. So those of you that think you're immune by being young, you're not. So it's less chance, but there's still a bigger chance than you want if you get this disease. Get immunized, social distance, and wear a mask in crowded places where you can't social distance. Indoors. Outdoors, have fun.
All right. Always great to talk to you. Dr. Todd Husty with Seminole County, thank you so much.
Thank you, Amy. Appreciate it.